Go to the next one, Dr. Parth Mehta, who will be talking on multimodal imaging in idiopathic retinal vasculitis, IRWAN, 4 cases.
Good evening to the esteemed panelists and to everyone present here. Today my talk will be on multimodal imaging and management of 4 cases of IRWAN. The acronym IRWAN was given in 1995 to describe idiopathic retinal vasculitis associated with neuroretinitis and characteristic vascular changes such as Hyde knot-like aneurysms, capillary non-perfusion areas, and in advanced stages neovascularization of the retina and the optic disc. Purpose was to describe the multimodal features and treatment in these cases. It was a retrospective chart review of 4 cases who underwent serial fundus photo imaging, fundus fluorescein angiography, and OCT analysis over a period of 4 years. All the patients were evaluated completely along with vasculitis and systemic evaluation. Case 1 is of a 32-year-old male who presented with floaters in both eyes and drop in vision in the left eye with no systemic illness. Vasculitis workup was negative. Right eye shows multiple hard exudates and aneurysmal dilatation of vessels at the optic disc and along the blood vessels with capillary non-perfusion area seen on fundus angiography and hot disc seen on FFA. Left eye showed similar features but it's all features of IRWAN. The patient was started on mycophenolate mofetil 500 milligrams along with tapering dose of oral steroids. On follow-up, there was response to treatment and there was reduction in exudate seen in both eyes. The left eye developed a scarred choroidal neovascular membrane seen on SSOCTA. Right eye was subsequently involved 6 months later with presence of macular edema. Due to risk of traction in view of pre-existing fibrosis, peripheral laser was done before anti-VEGF in both the eyes, and there was resolution of CME post laser. As you can see, the patient is stable at follow-up with well lasered peripheries in both the eyes. Second case is of a 31-year-old male with vitreous hemorrhage in the left eye, multiple aneurysms seen along the vessels in both eyes. So ipsosocity shows CNP areas in superficial plexuses and larger CNP areas are seen on FFA in both the eyes. So because of this extensive CNP, he was lasered and on subsequent follow-ups, he further developed CNP areas which was subsequently lasered, and now patient is doing well with BCVA of 6.6 and 6. Coming on to the third case is a 10-year-old child with a BCVA of 6/60 in the right eye, 6.6 and 6 in the left eye. Multiple hard exudates with retinochoroidal anastomosis is seen in the right eye. Left eye hard exudates were seen close to the fovea. The right eye has got a presence of CNVM. Fundus FFA showed presence of capillary furning in both the eyes. On follow-up, we had developed cystoid macular edema, and in view of inflammatory pathology, we had given an injection IVTA to which the CMA responded. Left eye also showed hard reduction in exudates seen both clinically in both the eyes. And the case 4 is of a 32-year-old male with features of IRWAN in both eyes. On investigations, he had very less CNP areas, and we decided to observe this patient in view of no extensive CNP areas. So a comprehensive literature search shows no fixed algorithm or management protocol in these cases. Multiple treatment modalities have been shown, which include corticosteroids, anti-VEGF injections, biologics, DMARDs, as well as multiple anti-inflammatory drugs. A study group suggested that there is no true neuroretinitis in these cases, and that the exudative maculopathy is because of the leaking lipid exudation from the microaneurysms. So to conclude, IRWAN syndrome is a rare retinal vasculitis disorder of unknown etiology with diversity in treatment approaches and final outcomes. Multimodal imaging is effective in the diagnosis and management of these cases, and close follow-up and prompt treatment is crucial to save vision in these cases. Thank you.
Thank you, Parth. Nice photos. How will you differentiate from labors and adult coats?
Yes, sir. Generally,
because the first one looks like.
Correct, sir. But labors and coats,
adult coats, yeah,
will have usually unilateral presentation. Plus, the aneurysms, the location of the aneurysms is pretty peculiar. Along the optic disc, generally they are not found in coats. They will be found even further at the arcades and even beyond, sir. So the location
the
of
third one did not have anything that were you lasered, no? Nice.
Yes, sir.
Even sickle cell retinopathy can something like that.
Yeah. Yes, sir.
So that.
Prospective study, retrospective.
Observational study. Chart review, sir. Comparison.
IRWAN is a diagnosis of exclusion.
Exclusion, sir. All these patients had a negative workup, and vasculitis workup was also negative.
That is, even the other things will not get any positive workup, labors, clinical only.
Yes.
So there was neuroretinitis also. Did you do some VEP or something in any of these patients?
Yes, man. All of them had a neuro-ophthalmology referral, and there was no specific cause. They ruled out all the infective causes of
VEP
neuroretinitis.
was the latency and all these things affected in them? If
No, ma'am. No, VEP was not actually affected. Not in all cases VEP was done. A couple of cases VEP was done. ma'am.
just the latency or something, they were normal.
No, they were normal, ma'am, in these cases.
That's
In
good for
fact, in
fun.
Irvan, the term neuroretinitis
It's a misnomer.
a misnomer.
It's a misnomer, ma'am.
Because every case of retinitis and optic neuritis, they always have a latency effect.
Yes, ma'am.